Hello, friend. Welcome once again to the Journey Podcast. We are happy that you have joined us here today.
Yes, welcome back, guys. We're so glad to be back. We just got done with Adventist education. That was so exciting.
We wrapped up season 1 of the Journey Podcast, which was September. We did 4 episodes on Adventist education. That was great, but now we're jumping into a new season.
That's right.
October is Mental Health Awareness Month. So for that reason, today we have
a special guest.
Yes. And that is Dr. Elysia Cohen, everybody.
Welcome.
I love the sound effect.
How are you?
I am, as I was telling you when I came in, I'm tired but excited.
Yes?
Tired but excited.
So tell us a little bit about yourself.
So I'm from Bronx, New York. Moved here to Houston last year. So it's been 1 year and change being in Houston.
Really? You barely here 1 year?
Barely here 1. It feels longer, doesn't it?
Welcome to the humid and hot city of Houston, Texas.
Yes, it's definitely humid and hot. Finally cooling down, so I'm appreciative of that. But yeah, I like it here. It's just too hot and people can't drive. Those two things. Yes.
Dun, dun, dun.
Mm-hmm. That's what I've learned in a year.
Yes.
But other than that, it's great. So yes, I'm from Bronx, New York. I moved here last year. My brother and sister-in-law actually moved here as well. So I have family around, which is really nice. I'm a fellow at MD Anderson, on the pediatric side. So I do oncology and hematology. I'm in my second year now. And it's crazy. Time is just flying. It's flying.
So awesome. Congratulations.
Girl power.
I know. That's awesome. Tell us a little bit about your career, your medical path, your journey.
I already completed residency. For medical students, when you graduate, you have to pick what you want to do. So I could have done family medicine. I could have done surgery. I could have done psychiatry. Yeah. I chose pediatrics because I love kids.
Okay.
And we'll come back to that. But I finished my pediatric residency. And now I'm sub-specializing in specifically cancer and blood disorders for kids.
Wow.
Yeah. So it's another 3 years. I'm in the second one. It's more focused.
Okay.
Wow. Yeah.
So October Mental Health Awareness Month. As a medical doctor, you have, a certain amount of knowledge when it comes to depression. What can you tell us about depression? What is depression?
Okay. So I will start by saying I'm not a psychiatrist, but we do have general training kind of in everything after you finish med school and you go into your residency. So I was privileged, I'll also say privileged for this population, to see children with depression. And so the first thing you learn is in medical school, how do you diagnose something? A lot of things have criteria that people have to.
To interrupt, but usually when I think about depression, is like somebody has had a hard life, right? So it's like or a stressful day or a stressful life, that death and whatnot, and that's why they're depressed. But in children, I've never imagined that children go through that.
Oh,
that's a good point. That's a very good point.
Right?
Yeah, it's true.
I think kids go through so much.
Wow.
And when you're on the other side of the table and they're telling you, all that's going on, you realize, wow, it's really hard being a kid, especially like in that 10 to 12-year-old range and extending into like the mid-teens, 15, when they're trying to figure out who they are, where they fit in, what their purpose is. And in navigating that, you can find people that will tell you, well, you're nothing. Why are you alive?
Wow.
And they'll tell you these stories and like people told them to go kill themselves, and so for a child hearing that, and it's in that important phase of life where they're trying to figure out who they are, it can be very depressing and very hard when the peers or the voice of their peers is the most important.
Wow. And you mentioned something really key, and if there's parents listening, I want to emphasize on that. Their peers, and their peers, where do they spend the most time? Sometimes at school. You would think that sometimes kids are, they come from a healthy home, they are very loving parents, but you have to think of the different dynamics and the different environments they're exposed to. And sometimes even the friend you think is your friend might be the one who could be hurting those children individually. So unfortunate.
Yeah, it's really unfortunate.
So when we talk about depression in kids, what ages are we talking about?
Oh, it can pretty much be any age. I see it more so in, or have seen, once again, I'm not a psychiatrist, but I've seen it more so in the teens. So like from that 10 to 15,
Okay.
they'll come in. And so when I used to see them, they would come into the emergency department, depressed and suicidal.
Wow.
So that's the box that I would see them in. So maybe they had been struggling for longer periods of time, but they just got to the point where they're like, my life is no longer worth living. And either they had a plan to do something to themselves or somebody caught them doing something to themselves. So they already took, most of the time it's like Tylenol, that they'll pop like a whole bottle of Tylenol or something like that, or whatever pills are in the house. So that's the point where I would see them, when they've already tried something or said to somebody that they would like to try something, or are in just generally a bad state. So the population that I would see most in that state would be like that 10 to 15, that kind of age.
Okay.
Wow.
Okay.
That's like finishing elementary and starting middle school.
Yes.
And as a school teacher, I can tell you see that age struggling, especially with identity, as you mentioned. And wow, it just makes you think about those kids at such a young age going through so much.
So much.
So depression, could you define depression? What is depression?
Okay, so we have a nice little acronym that helps us all remember the symptoms to look for, or the criteria to look for clinical depression. And so you have SIG, E, CAPS. So sleep. Next, so S is sleep, I is interest, so loss of interest. G is guilt. They'll have like a sense of guilt. E is lower energy. And then CAPS, C is concentration. They tend to not be able to focus as much. A is loss of appetite. Or they'd be also say anorexia, but it's like they don't want to eat. P is psychomotor. So a lot of patients will say, like, I feel like I'm moving through peanut butter. Like I can't get up. I can't move. And then S, suicidality is the last one.
Wow.
Yeah. And so you need at least 5 of those criteria or more over the course of 2 weeks. So they have to have it for at least 2 weeks, 5 or more criteria. And then they will be diagnosed with clinical depression. Now, if they have some of the criteria, but not all, there are other categories that they can be placed into, or conditions they may be diagnosed with based on the DSM criteria, which has all the psychiatric disorders.
Right.
I think we're still on DSM-5. They update it every so often, but I believe we're still on DSM-5.
Okay. So is depression those are some of the symptoms. So if someone is going through those things, that's why they ask you at the doctor's office.
Yeah, that's why they ask you.
Right?
Yeah, because they need, technically to officially diagnose you, you need 5 or more of those 7 for 2 weeks or more.
Okay.
Wow.
Consistently. Yeah.
So those are some of the symptoms. And if you have that, you might be depressed.
Yes. Yes.
Is depression a chemical imbalance?
Sometimes it can be. So if you know about antidepressive type medications, some of them help to like increase your serotonin, which makes you feel better. So yes.
Okay.
So yes, I'm going to answer yes.
Okay. And then, so when it comes to like kids between 10 to 15, what are some of the causes why these individuals experience or have depression?
So I think there are a lot of different reasons that kids can be depressed. At least, once again, not a psychiatrist, but the kids that I would see in the ED that were coming in, most had either some kind of bullying at school, were told that they weren't good enough or not enough, had problems at home where they didn't feel either safe to express themselves, or had some other issue within their family structure, and some had a combination of all of the above.
Okay.
So each kid had a different reason for why they were depressed or suicidal in that moment. But a lot of it came back to like they didn't feel like they were enough, like that their existence was important, and they didn't feel like anyone would miss them if they weren't there.
Okay.
So those were like the commonalities, let's say that.
You know, it's interesting when you say that, I'm immediately thinking about scripture, about the Bible, and how often God tells us in scripture about who we are in him and about our value in God, right?
Because he knows we need to hear it. He knows we struggle with those things. And so he tries to reassure us daily through his word. And that's powerful, though, when you apply it into this spectrum, which takes me to my next question, too. What would you say to a parent who I don't like to use the word denial, but I just see it so much that they don't believe, especially when they are based on their religion. I'm going to say religion, very open in general. And they just pray to God, or you must have done a sin. How do you go about that? Because it's kind of hard to have parents contribute and help and get the care for their children when they themselves are not seeing the need that the child is going through.
So I would definitely say for the Christian parent, yes, pray. Yes, seek God on behalf of your child. At the same time, they can be simultaneous. Seek medical help. So seek God, seek medical help and attention, and put those two together. I think there's no better combination than both.
Right. And a lot of people, here's a misconception that a lot of people will say, we only need God. God will do the miracle. Pray more. You must have done something. And they bring that confusion in a lot of young people, I would say. And I agree with you. You know, I believe that God calls us to do our part, but then he's put people in our lives that are meant there to help us in his behalf. You could almost say, like, we pray for things and then God provides and we can't accept the answer.
Yeah. That's funny. I think there was this, you know, the story of, you know, man drowning, and then he's praying to God, and God sends a boat, and then he's like, I'm waiting for God.
Right.
You know,
that's exactly what I'm talking about.
So that's what popped into my mind when you said that. And I think there is a lot of stigma on mental health in general. If you had a cold and your kid was having, you know, diarrhea for the last 3 days, you would be in the ED in a heartbeat, and people would bring their kids in the middle of the night to the doctor. I'm sure they would pray too, but they're bringing that child to the doctor, you know. But then the same child is depressed, not doing well in school anymore, not interacting with their peers or their family, not really getting up out of bed half the time, and then all of a sudden we only pray and we don't also
act.
Yeah.
Right. Exactly.
I think there's just a lot of stigma with mental health in general.
So if it has to do physically with something, we kind of act. But when it's mentally, we think God can only provide the care, in which he can.
He can.
But we have to be careful in what we're doing for our children, what we're saying, and reminding ourselves that God is leading people in our lives. God puts people in our lives.
Agreed.
What are some of the things that you have seen between those kids that, you know, whenever you saw them, what is a common denominator that you would want to warn an audience about?
So I would say, I guess for parents, it's really important to check in with your kids. They are not always going to be forthcoming with you on things that are going on, but really pay attention to like the little things that they maybe have stopped doing that they found fun at one time, or if they, you know, you don't see a friend that they used to see all the time at the house, it might be good to ask why. And the reason why I'm pulling these things in is because a lot happens at school, and kids are, or tend to be, not every child, but tend to be very in tune to what the other kids think and feel. So if one kid is ostracized, they might also pull away from that person just so that they're not included in that, you know, shunning if that's a good way to put it. And then if your child is the object of that isolation, their friends might pull back the ones that you've seen for all these years. And then you might just think to yourself, oh, I haven't seen X, Y, and Z in how many weeks. That might be something that it would be good to ask your child about. It's a little
Some
thing.
warning signs.
Okay.
Okay.
And they might say, oh, nothing. Or, but if you keep just being present and maybe hinting, I'm here to talk about things if you need it, I think that would be also a good thing that parents could actively think about and do. But I think the most important thing is having open communication with your kids and letting them know, well, I'm here if you need it. I'm here to listen, and maybe asking them about the little things in their life that you notice, either good or bad, that have changed or developed. Maybe they'll come home and they'll slam their door. It might be good. Give them like half an hour, then go check in. How was your day? I used to hate that question, but how was your day?
Or they'll come, don't slam that door ever again.
That was also.
And then you get the door removed. But right. Yes. Baby steps, parents, we're learning. Be patient and loving with your child. Have daily and open conversations.
Yes.
Absolutely.
That's what I would say. And pay attention to the little things, because sometimes the little things are actually big things. And if they realize that, oh, my parent noticed that and that was like a really big thing for me, they might just break down then and tell you.
Right.
It's about paying attention to little things. Let's say that.
Because the little things can build up eventually, right? So you can
they
prevent that. That's already a huge step.
Yes.
So if someone, if a friend, approaches another, kid, another friend, and says, "Hey, sometimes it was like, hey, what's wrong?" It's like, "Hey, well, sometimes I think that life is not worth living." What, as the friend on the other side, what are some of the things that person should do or say?
That's a great question. I would probably start by saying, "What do you mean by that? Can you tell me a little more about that?"
Okay.
What do you mean life is not worth living? And just leave it open-ended. And you'll be surprised. People will tell you exactly why life is not worth living if they think that they have the capacity or the space to do it. So what happens a lot of times, people will laugh it off and say like,
That's right.
and then move on. And
or
then
we say, "What do you mean life is not worth living? Look at this, look at that, look at what you have."
Yeah.
I see.
And for that person that said it, they're like throwing it out there just to see, can I tell you about it? Is it safe to do that? Would you listen and not judge me, for where I am right now, Wow. And so sometimes it's just good to ask another question, what do you mean by that? Or I see that you just said X, Y, and Z. Can you tell me more about that? And you'll be surprised what people will tell you.
So what's the purpose of those questions? What are you looking for? And what should you do in the event that someone says, "Hey, well, I think about killing myself sometimes"?
Okay. So the purpose, I'll start with the first question. The purpose of asking those questions is to determine why that person or where that person is, why that person made that statement.
Okay.
And then where they are emotionally. Because let's say they said, "Oh, life is not worth living." And then you say, "What do you mean by that?" And then they'll say, "Well, I had a hard week, and let's say, my car had this issue and that issue. And I wasn't able to meet this deadline." And then you'll say to them, "Oh, wow. How did the week end?" And then they'll say, "Well, you know what? I fixed this, and this. I was able to do this and this. And at the end of the week, everything worked out." That person has been able to have a problem and then fix it, and then was able to tell you what happened and how they fixed it. and the next week could be a great week. And then they'll see you next week and say, wow, I had the best week ever, you know?
Yes.
So there's that. And then there's a person that tells you, my life is not worth living. And then you say, what do you mean by that? And they might tell you, you know, I think to myself every day, why am I alive? Why did God make me? Why am I here? And I don't have a good answer for that. And I think if I weren't here, the world would be a better place. Then you have a totally different scenario to work with, right? And then your next question was, what do you do with that, right? So I would say, well, for me, I see kids a lot. So it's a little different, but this could be with an adult as well, that, you know, you're talking to your friend and they have this concern or this lack of identity. And you can say to that friend, well, I've listened to you. Now, have you talked to anybody in a professional capacity about this? And they may say yes, they may say no. And you can just once again, open-ended question, you know, have you ever thought about that? Or what do you think about that? Because some people might jump and say, but no, I don't think I need a doctor for this. It's not that bad. And then you can support them as they come to the realization that, you know, maybe I'm not in a good place and maybe I do need help beyond what I think I need. And so I think it's really important for the listener to really understand where that person is and what their problem is, and then you can help them get to where they need to go. So for like, you were asking like resources. So depending on where they are, if they're suicidal, I would send them to the emergency room or call a hotline for suicidality, because those patients, if you don't catch them at a point, at the sentinel point, then the next time you go to see them, they might have already committed suicide and it might be too late. So you don't want to leave that. You want to send them directly to the emergency room so that they can get the help they need. And it's also for their safety, you know? But all in all, I think a medical attention would be helpful, whether is taken to an ED or they see a psychiatrist separately, depending on how far along that spectrum that they actually are. So if they're close to suicidality, I would just send them in right away. If they're just really sad and are kind of like becoming into the depressive spectrum, then it's good to catch it early and you can get them to a psychologist, psychiatrist early so that they never get to the point of wanting to end their life. You know?
Wow. You know, and a lot of things you mentioned when you converse with someone about this topic, I noticed that you navigate it with them. You don't really tell them what to do. Sometimes I feel like as friends, even when you're trying to do the good thing, you respond to people and individuals like you know, Sergio was saying, well, what do you mean? Life is great. Sometimes even those words from someone can do a negative effect versus tell me about it, asking questions, making it about them and not about you. And I would say this is the best place to practice active listening.
Yeah.
I think this is key to truly try to understand, not so much give solutions.
Yes.
And it's a process.
It is a process.
Wow.
Would you say that depression can be overcome?
Yes. Yes.
Okay, so if someone is dealing with it, there is a way out. You've seen,
Yes.
Have you seen that?
Yes.
Okay.
And I would say 100%. But when you are depressed, you don't feel that there is a way out. And that's the scary thing. A person who is really depressed and get to the point where they feel they have no solutions, that's when they become suicidal, because they're saying the only solution I can see is to not exist.
Wow. Okay.
So I feel very passionately about this particular topic. Although, as I mentioned, it's not my specialty, but yes, it's important to catch people before they get overly depressed and suicidal, because if you catch them early, you can give them the help and help them to realize that they are important. Their life is important. They have a purpose and a reason for being here. And sometimes people need medications in order to get to a place where they feel whole and happy and healthy. Some people are good with just therapy. They just need to talk it out. Everyone is different, which is why it's good to see a medical professional and they'll evaluate and figure out what you need. Some people need both therapy and medications. You know, each person is different. But I think the best thing is when you start seeing those early signs, send your kid in.
Jump in.
Yeah, it's like marriage counseling. You know, you don't go when the marriage is ended. You go early so you can fine tune. Same thing with a psychologist. You don't have to be super, you know, depressed or anxious in order to see one. You can learn tips from them to prevent.
But unfortunately, in our society, I think people wait. From what I have seen, I think people wait till there's a problem. It's almost like when you're sick. I mean, I grew up in a home where my mother said, Vicks fix everything. So as an adult, my husband has to get after me and remind me to go to the doctor. And I'm like, I don't need to see the doctor. I'm perfectly fine. And so it's not until you're literally in bed dying that you go to the doctor. And I think it's the same application we can do in this case. And I really love the fact that we have you here today, because this builds awareness for our young children, parents that are out there listening. Truly, I pray that this is a message that they will hear, because it's a taboo in our society. It is a topic that we so desperately don't want to talk about. It's scary. I don't blame them. As an educator, I see so many things on a daily basis, and there's only so much I can say, right? I'm not a doctor. I'm not a diagnosis. So it's good to know there are people out there that are educated. And I like what you said, because there's a misconception in this. And I will say this. Parents think that getting help means getting their child under medication. And that is, I think, one of the biggest mistakes that's out there. Because even if you are recommended, you don't have to. And there's other ways.
But you're aware.
Right. You're aware.
Now you know for a fact that, you know, your child has clinical depression and you can be proactive on that.
And one of those things is like the therapy or sessions, you know, you have individuals, counselors. I mean, there's amazing counselors out there for children, you know, that they specialize in this and they just know how to reach and help these kids on an everyday basis.
Yeah. And most pediatric psychiatrists, you know, and doctors in general, we don't give medication unless we feel it's absolutely necessary. So that's another thing to help with the fears.
Is it kind of like the concept of when you go into surgery, it's like the last thing between life and death? Like I always tell when I go to the doctor, I'm like, if this is something that I really need, I know I have good insurance, but please do not open me up. It's kind of like that thing. I hope. Good to know.
You know, I have learned today, and perhaps it has set in that early teens and teenagers and kids can be depressed.
Yes.
I've always seen it as like, oh, you know, what could you possibly complain about your life?
It's until you get older, you're like, oh, what have I done?
Yeah. So I want to appreciate, and I think that the purpose of this conversation is to contribute to the mental health awareness, the depression awareness, that it is a real thing.
It is.
Just because you are a Christian and you believe in God and you believe in Scripture doesn't mean that you can't, you know, seek help. God has placed people in your life, medical doctors, therapists, psychiatrists, to help you in that journey. And of course, you know, you have your church family that can pray for you, that can give you spiritual support in this journey for you and your family.
Amen.
So, Elysia, thank you so much.
Yes,
you're welcome. Thank you for having me.
Yes, amazing. I've learned a lot. You know, you hear this topic, but you always learn something new.
Yes.
And it's good to hear things, because sometimes it takes more than once to understand it. So thank you so much for being here with us today.
Thank you for having me.
Now, some fun questions for you.
Yes.
What does Elysia Cohen do for fun?
Oh, okay. I don't have much fun. No. I hang out with my friends a lot.
You hang out?
I do.
What do you do with your friends?
Yeah. So it varies on the week, but I love singing with my friends.
All right.
Yeah. I like, we've done a comedy show.
Wow.
We've done concerts. We've done, escape rooms.
Yes, those are
fun. Okay.
Yeah. Going on vacation with one of my med school. I call her my life buddy. She got me through med school. We're going on vacation next month. No, this month is October.
Yeah.
This month in a few weeks.
Much deserved. Yes. Self-care.
Yeah. So those are some of the
Very
things
nice.
we like to do.
Very nice.
Nice.
Do you have any pets?
No.
Okay.
Very sad story. I've never had a pet.
Oh, very sad.
Very sad.
No children.
No
But
children.
you love children.
I do.
All right.
I do. I saw the cutest baby today.
Aw.
And I said to her, she was maybe, I would say 1 to 15 months.
Okay.
She had this cute little tutu, and I looked at her and I said, I think you're so cute. I love your tutu. And she just smiled. Even
They're
kids know when they get a compliment.
Yes,
Yes.
And it's okay to take it.
Amen. Here's a deep question.
Yes.
What will you say to Jesus when you first see him in the clouds?
That's beautiful.
Do you know the song? Sorry, I live in music. I Can Only Imagine.
Yes.
Yes, I love that song. I think I would be the one on the floor just weeping. Why me, Lord? I made it? I made
Wow.
it. Me?
Wow.
I think that would be me.
Yeah.
Yes. And then burst into song or tears or both.
Yeah.
One of the two.
What is your favorite food?
Favorite food. Can it be a dessert or it has to be like food?
I guess you could say dessert. That's
Yeah,
fine.
dessert's fine, yeah.
I love all things sugar. But I think my favorite is potato pudding. So my parents are Jamaican.
Okay.
So we have pudding. Okay. So it's not like the soupy pudding that, people sell in like the cups.
Okay.
It's more of, it's not a cake either, but it's formed like a cake, but the consistency is different. I don't have a good
You owe us a piece.
Yeah, I was going to say, you
that.
definitely now have to make that for us because we have no idea.
We're like, wait a second.
But that sounds
We want
delicious. Like
some
a
of
cake.
So I will say it's the hardest thing to make because you have to take the sweet potato.
Wow.
And my dad makes a very good one. He puts cassava in it too, but you have to grate it.
Right.
Okay. Yes, it's a lot of work.
So homemade.
Yes.
Just special ingredients from home. Nothing like home.
But what I can do, they're coming to visit in Christmas time, so I normally put in my orders. So I can have them bring
order.
some, and then you guys can try it.
Very nice.
Do it. Excited for it. Last question. What's the best advice you ever received?
Oh, wow. It goes fast.
It goes fast. What do you mean?
So I remember, I think I was starting high school. In church, you're everyone's child. So one of my church aunts, Auntie Marvella, she said, I'm so proud of you. You made it to high school. Then she said, enjoy it. It goes fast. And I was, at high school, you're 13, 12? So I was around that age, and I still remember it now. That specific phrase.
It goes fast.
And that,
You blinked and now you're here.
Yeah.
That is so true.
Actually.
Yeah.
So I think that's, or at least one of the most impactful things someone has said to me.
What is the worst advice you've ever received?
Wow, worst advice.
Don't give names. It's okay.
Well, I remember back in high school, I was taking this class and I was not doing well. I was not doing well at all. And we had our first marking period. And Ms. Carol was the teacher, that's an important one. And the teacher said to my dad, she's just dropped this AP class. She was like, she should just drop it.
Wow.
And my dad said, no, she's not going to drop it. She will pass this class. And I did. It took a lot of work and effort, but it did happen. And in that moment, the worst advice would have been quit, give up. You can't do it.
Mercy.
So, so I think that one's also like ingrained in my brain. And, the fact that my dad said, no, she can do it.
And look at her now, Dr. Elysia in the house.
In the house.
I love it. Yes, exactly. Never tell a child they can't do it.
Thank you so much for being with us here, folks. This is the end of this episode on depression.
Thank you so much, Elysia, Dr. Elysia, I should say, for being here with us again today. Truly appreciate the time you've taken to be with us.
Hi, Pastor and Sister Carol.
This is the month of mental awareness, so we are going to continue talking about specific topics as we did today with depression. Next week, please join us. We are going to have Miss Styles in the house. So we will have her next Wednesday, September 18, and we look forward to having you guys join. We will be talking about bullying specifically. You won't want to miss out. Share and be there with us, joining us live at 8 p.m.